I think the Dent Neurological Institute, since 1963, has been a bastion of neurological care. Individuals in the community are aware that we offer a certain amount of neurological care that emphasizes open access, emphasizes personal care, and also they know that we have the highest technology with a support system that is, in this country, has no example of. Because we're the largest neurological institute in the United States and have a national reputation in the field of neurology, we are able to recruit any subspecialty that we're interested in.
So we've developed an institution here that dates back many years as has evolved from a very basic model of care and compassion for humans, for each other and for our patients. And I think that that has really carried through to the attention that we put into the talent that we bring into the organization and the respect that we have for the individuals in the community to try to solve their problems and to do so in a way that follows a nice hospitality model. I think it's important to understand the healthcare environment in which we live. Everyone knows that there's such debate on trying to solve a complex problem, and the way to solve those problems is to try to get in front of the diseases. We recognize the need for hospitals, and we value our collaborators and colleagues in those hospital settings. What we wanted to try to do when we moved out of the hospital setting is to create a community access that moves the disease diagnosis and treatment nearer to the homes, in the community, deal with these chronic disorders in safer, more comfortable, more accessible ways. So our access model is a real key to not only having people be able to get in to see you, but to create the right kind of a volume of activity that allows us to recruit subspecialty neurologists. So it all feeds together.
We don't isolate ourselves. We work with Roswell Park. We work with the University of Buffalo. We work with all the hospital systems. We're an institute because we educate, we publish, we write books, we give national presentations. So we're so large in size that we have to, in fact, be able to work with everybody. And that, I think, is part of our success, because our relationships and the Western New York mentality of cooperating has been part of our success also. Joe has strongly supported the concept of pre-disease treatment. So we are now planning to develop a large center of excellence, a wellness center, that focuses on preventative medicine, being nutritionists, physical therapists, chiropractors, massage therapists, social workers, everything you can imagine that will benefit our patient population before they suffer from the disease itself.
I think one of the real advantages that we offer to the community is when you have a disorder that is in the scope of what we treat, the ability is there for us to understand the entirety of what's going on with a patient. We do strive to be the highest quality hospitality organization with efficiency that respects the time and has the compassion for what our patients are facing.
So we cover all the subspecialties, and when we feel that our community deserves something more than what we have, then we move into that part. And everything we do is based on what our community needs. When that happens, we become successful. And when we become successful, then it's good for everybody.